Hello, my name is Dr. Norman, Keith Norman, and I am your advisor for NU16 and 611. So I'm doing the presentation on how to present to the preceptor. Some of the things that's really important are, you want to speak clearly, you want to speak loud, and don't focus on looking at your notes too much. And so I have a PA student here today, Madison, and we're going to do a demonstration.
Go.
Okay.
Okay, so today I have a 69-year-old black male with bilateral hearing loss, history of schizophrenia, and ED, and he's here to establish care today. His primary concerns are his erectile dysfunction, that the fact that he can't hear, although upon physical examination he answered all my questions just fine. It doesn't appear to impair his life, and then his cataracts. All other review systems was negative, and his vital signs were within normal limits. He is sexually active. He does not use alcohol or drugs, but he does have an 8-pack year smoking history. He currently lives in the VA home. He gets 3 meals a day, exercises regularly. His medications include 0.25 milligrams of Xanax every night to help him sleep, and a multivitamin.
Okay.
On his physical exam, he had some teeth missing, but otherwise it was unremarkable. So for my assessment and plan, I'm going to refer him to psych because he doesn't have a psychiatrist currently.
Okay.
Optometry to help with his cataracts and evaluate that.
Okay.
And since he's 69, he needs colonoscopy.
He does.
So I'll be referring him to GI. I'll be refilling his Viagra since he says his erectile dysfunction has bothered him. And then for his hearing, we just figured maybe observe since it doesn't appear to impact his functionality. And then for labs, just do a full workup on him, CBC, CMP, hemoglobin A1C, lipid panel, and then screening for all the STDs, hepatitis, HIV, RPR, and then follow up in 2 to 3 months to see how he's doing.
Okay, great. So we see 69, so you're doing a colonoscopy. Okay, so that's good. How about pneumonia vaccination? Because anyone over 65 years old, starting at age 65, that's when we kind of start the pneumonia vaccination. So you know if you had one or not?
I think he said he did.
Okay.
I didn't put that in my notes, but it wasn't in my plan. And I think that he had said that he had one.
Okay, good.
And then also.
Okay. So thank you, Madison. So Madison, tell me what some of the things that you struggled with when you initially started with presenting to the preceptor.
A lot of times I tend to struggle with, I know, being confident, so that's a big one. A lot of times people say fake it till you make it, and it works. And I know I also tend to struggle with sometimes being organized, so it helps. So for me, I have a little sticky note here, and I just bullet points. So that way you're not reading off of your notes, but you can glance down to remember. So that also helps with the presentation.
Okay, great. All right, thanks so much, Madison. All right, thank you.